Hello friends, today let's talk about the topic common postural deviation, their causes and remedial exercises for kyphosis, scoliosis, lordosis, knock knee, bow leg and flat feet. Let's start with the introduction. The adult human skeletal system consists of 206 bones, as well as a network of tendons, ligaments and cartilage that connects them. The skeletal system performs vital functions such as support, movement, protection, blood cell production, calcium storage and endocrine regulation that enable us to survive. The skeletal system gives the body its basic framework, providing structure, protection and movement. When there is an imbalance in function of the soft tissue as well as bones, skeletal deformity may occur. Some of the deformities are kyphosis, scoliosis, lordosis, knock knee, bow leg and flat feet. So here comes the kyphosis. Kyphosis, also known as round back or hunchback, is a condition in which the spine in the upper back has an excessive curvature. The upper back or thoracic region of the spine is supposed to have a slight natural curve. The spine naturally curves in the neck, upper back and lower back to help absorb shock and support the weight of the head. Kyphosis occurs when this natural arch is larger than normal. So here comes the common causes of kyphosis. Kyphosis can affect people of any age. It rarely occurs in a newborn because it is usually caused by poor posture. Kyphosis caused by poor posture is called postural kyphosis. Other potential causes of kyphosis includes: first one, aging, especially if patients have poor posture. Second one, muscle weakness in the upper back. The third one, Swayamprabha disease, which occur in children and has no known cause. Fourth one, arthritis or other bone degeneration diseases. Fifth one, osteoporosis, the loss of bone strength due to age. Sixth one, injury to the spine. Seventh one, slip discs. And last one is scoliosis or spinal curvature. So here comes the exercise for kyphosis. Weak, tight muscles in the chest and back are common symptoms of kyphosis. For the chest, a simple wall stretch will suffice. Stand with one side against the wall, the arm up and palm flat against the wall, then turn to face away from the upturned arm. Do this for both sides. For the back, try a hanging leg stretch. Find a pull-up bar, grab it with an overhand grip, relax and hang from the bar. Perform each stretch for 30 seconds. So here comes the scoliosis. Scoliosis is a condition that causes the spine to curve to the side. It can affect any part of the spine, but the most common region are the chest area, that is thoracic scoliosis, and the lower section of the back, that is lumbar scoliosis. So here comes some of the possible causes of scoliosis. First one, neuromuscular conditions. This affects the nerve and muscles and includes cerebral palsy and muscular dystrophy. Second one, congenital scoliosis, that is present at birth. This is rare and occurs because the bones in the spine develops abnormally when the fetus was growing inside the mother. The third one is genes. At least one gene is thought to be involved in scoliosis. Fourth one, leg length. If one leg is longer than the other, the individual may develop scoliosis. Signs and symptoms of scoliosis. First one, the head is slightly off the center. Second one, the ribcage is not symmetrical. The rib may be at different heights. The third one hip is more prominent than the others. Fourth one, clothes do not hang properly. Fifth one shoulder or shoulder blade is higher than the other. Sixth one, the individual may lean to one side. And last one is uneven leg length. So here comes the treatment of scoliosis. So the first one is braces. If the patient has moderate scoliosis and the bones are still growing, a brace is recommended. This will prevent further curvature but will not cure or reverse it. Braces are usually worn all the times, even at night. The more hours per day the patient wears the braces, the more effective it tends to be. When the bones stop growing, braces are no longer used. And second one is casting. Casting instead of bracing is sometimes used for infantile scoliosis to help the infant spine to go back to its normal position as it grows. This can be done with a cast made of plaster of Paris. The cast is attached to the outside of the patient's body and will be worn all the times. Because the infant is growing rapidly, the cast is changed regularly. So here comes the exercise for scoliosis. First one, pelvic tilt. Second one, cat-camel exercise. Third one, double leg abdominal press. Fourth one, single leg balance. If possible, perform in front of a mirror to help visualize a straight spine. And the fifth one is teapot. If possible, perform in front of the mirror to help visualize a straight spine. And sixth one is side shift. So here comes the lordosis. Lordosis is a condition where there is an increased inner curvature of the spine. The spine has a natural curve which is very mild and it helps the spine in its proper function. The natural curve is formed due to the shape of the individual vertebra that makes up the spine. If the spinal curvature increases, then it puts a lot of pressure or strain on the other region of the spine, resulting in pain. So here comes the causes of lordosis. There is a syndrome called lower cross syndrome, in which muscles surrounding the hip and the spine become tense or weak along with the getting stretched. All these different conditions of muscles such as tight and weak muscle result in muscular imbalance. The muscles which are usually tight are trunk extensors, hip flexor, especially the iliopsoas muscles, and this tense muscle need to be stretched. The muscles which are usually weak and stretched are abdominal muscle, that is rectus abdominis, internal obliques and external obliques, and hip extensors, that is hamstrings and gluteus maximus. So here comes the symptoms of lordosis. Usually patients with lordosis do not have any symptoms except for the exaggerated spinal curvature. Other symptoms which may appear according to the severity of the curvature are low back pain, and pain may radiate down the legs. Changes in bowel and bladder, although this is rare. If patient has other problems along with lordosis, then the patient may have experienced developmental dysplasia of the hip, dystrophy of the muscle, or neuromuscular problems. So here comes the treatment for lordosis. If the lordosis is mild, then treatment is not usually required. If the patient is experiencing symptoms or discomfort, then the patient can enroll in a physical therapy program where exercises can be done under the guidance of a therapist in order to strengthen the muscles and to increase the range of motion. Medication such as NSAIDs or painkillers can be used to decrease pain or swelling if any. If lordosis is detected during childhood, then braces should be worn to prevent further worsening of this condition. For severe cases of lordosis, which does not benefit from the above measures, surgery is required when the spine is strengthened using metal rods, screws or hooks. During surgery, bone grafting can also be done to promote knee growth and to stabilize the spine. So here comes the exercise for lordosis. Hip flexor stretch, lower back stretch, abdominal crunch, twisting crunch and bridge. So here comes the next topic, knock knee. Genu-valgum, commonly called knock knee, is a condition in which the knees angle in and touch one another when the legs are in strengthened. Here comes the common causes of knock knee. First one, knock knees are usually part of the normal growth and development of the lower extremities. Second one, some cases, especially in a child who is of 6 years or older, may be a sign of an underlying bone diseases such as osteomalacia or rickets. Third one, obesity can contribute to knock knee. The fourth one, the condition can occasionally result from an injury to the growth area of the shin bone, that is tibia, which may result in just one knock knee. So here comes the treatment for knock knee. Persons with knock knees often have collapsed inner arches of their feet, and their inner ankle bones are generally lower than their outer ankle bones. Adults with incorrect genu-valgum are typically prone to injury and chronic knee problems such as chondromalacia and osteoarthritis. This in turn can cause severe pain and problems in walking. It is normal for the children to have knock knees between the age of 2 and 5 years of age, and almost all of them resolve as child grows older. If symptoms are prolonged and pronounced or hereditary, doctors often use orthotic shoes or leg braces at night to gently move a child's leg back into position. If the conditions persist and worsen later in life, surgery may be required to relieve pain and complications resulting from severe or hereditary genu-valgum. Available surgical procedure includes adjustment to the lower femur and total knee replacement, that is TKR. And here comes the exercise for knock knee. First one, activating and developing the arches of the foot. Second one, waking up the outer leg muscles, that is abductors. Third one, learning how to move the inner ankle bones inwards towards the outer ankle bones and upward toward the knees. And here comes the bow legs. Genu-valgum, also called bow-leggedness, bandiness, bandy leg and tibia vera, is a physical deformity marked by outward bowing of the lower leg in relation to the thigh, giving the appearance of an arched bow, usually middle angulation of both femur and tibia. So here comes the causes of bow legs, that is genu-valgum. Rickets are the primary causes of this physical deformity. Bow-leggedness remains persistent under the following condition. First one, if a child is unwell due to rickets. Second one, if he or she is suffering from any disorder which restricts the ossification of the bones. Third one, if the child is not properly fed. In a few cases, infants suffer from one-sided bow leg, problems due to tumor, skeletal problems or infections. A few disorders possible, medical disorder which can lead to genu-valgum in the body of the patient may include: first one, pseudochondroplasia; second one, hyperptosis cortical deformans juvenile; third one, cafe disease; fourth one, canthomelic dysplasia; fifth one, osteofibrous dysplasia; 6.1 osteomalacia, 7.1 osteoarthritis, 8.1 kyphomelic dysplasia, and 9.1 endoplasia, and 10.1 Blount diseases, and last one is vitamin C deficiency. So here comes the treatment of bow legs. In infant, genu-varum resolves with ages. The correction generally initiates between 3 to 4 years of age. If genu-varum in infants becomes severe, it can be treated with surgical and non-surgical treatment. The first comes with the surgical treatment. In rare cases, when genu-varum does not resolve completely, it gives rise to cosmetic concern among parents of an affected kid. If the physical deformity is severe, medical surgery is often recommended to such patients to correct the bowing completely. So here comes the non-surgical treatment. If bowing does not resolve within 6 months of its occurrence, doctors often recommended non-surgical procedure for such patients. This technique includes use of medicines and drugs. So here comes the exercise for bow leg. Leg strengthening. By performing leg strengthening exercises, we can help to strengthen the muscles surrounding knees and hence alleviate some of the pressure that is being placed on bow legs. These are most effective in people who only have a slight bow in their legs and generally involve placing a weight between the feet and bending and re-strengthening the legs. And the next topic is flat feet. Flat feet, also called pes planus or fallen arches, is a postural deformity in which the arches of the foot collapse, with the entire sole of the foot coming into complete or near complete contact with the ground. So here comes the causes of flat feet. First one, tarsal scoliation. This is the condition that develops during early childhood wherein an abnormal fusion of some foot bones makes the foot stiffer and quite flat. Second one, the tibialis posterior or tendon dysfunction. In this condition, a large ankle tendon can degenerate, causing it to stretch and cease working correctly. The third one, overweight. Excessive laxity in the joint due to sudden weight gain could also be a possible causes. The fourth one, arthritis. Especially if it occurs in the back or middle of the foot, it could be really painful. So here comes the treatment of flat feet. There are both non-surgical and surgical options to treat the foot syndrome. The non-surgical option. If the affected foot is flat but flexible, then it can be treated with simple insole and physiotherapy. The idea is to support the foot to stop it from getting worse. And the surgical option. Surgery is sometimes required if the condition is more severe. The following procedure may be considered. The first one, the calcaneal osteotomy. The second one, a tendon transfer. The third one, fusion of joint of the foot. So here comes the exercise for flat feet. The first one, toe flexion. The second one, calf muscle stretching. Third one, heel raise. And fourth one, phatic stimulation. So here comes the conclusion of today's talk. From all this discussion, it is well known that musculoskeletal deformities can cause imbalance of entire alignment of the human body. These deformities affect not only socio-economic status of the patient but also mental status. Early diagnosis and treatment has considered to be potentially success and worth considering for the purpose of enhancing intervention effectiveness, successful implementation and prevention of prolonged deformity.